Now, coming off Veterans Day, it is important to address the health and well-being of our service members. And according to Mental Health First Aid from National Council for Mental Well-being, nearly 1 in 4 active duty members showed signs of a mental health condition. Joining us now to break this all down is Dr. Lipi Roy, internal medicine physician at Greenwich House. Thanks so much for being here.
Thank you, Bianca.
We see that we may not take care of our veterans as best as we could, mental health being a massive issue. So what are we doing and what could we be doing better?
Yeah, so as you know, we just honored our veterans for their services and sacrifices. As a physician, I've had the honor of caring for many, many men and women who've served in our military. Since September 11, 2001, September 11th, 9/11, nearly 3 million active duty American military personnel have been deployed in Iraq, Afghanistan, and areas around the world. And we know that combat and deployment, as well as general military duties, increase the risk of mental health, developing mental health disorders. Post-traumatic stress disorder, PTSD, and depression are most publicized, but anxiety, substance use disorders, schizophrenia are also very common, as well as increased suicidality. In fact, 20 veterans die each day by suicide, and 88% of veterans' caregivers report increased stress and anxiety.
That's shocking. What can we do better as a country to make sure that those numbers trend downwards?
Yeah, treatment is critical, Bianca. So it's really critical for veterans and their loved ones to know that treatment is available. If you are experiencing mental health type of symptoms, get help. Combination of medications and therapy, counseling can really make a difference in improving a veteran's quality of life. And a lot of other services. Mental health first aid is also another great training, both for family members and the general public.
Yeah, the stigma behind that should be changed, because there's no shame in getting help in that way. You did mention substance abuse, and that kind of leads us to the next topic, which is a spike in overdoses. This is something that's happened recently. Can you talk more about that?
I can definitely talk more about it. This is certainly an area that I'm very passionate about as an addiction medicine physician. We are seeing an increase in overdoses, including at my own organization at Greenwich House Center for Healing, which is an opioid treatment program. Thankfully, the people that have been overdosing got treatment right away by our staff, and they're doing well.
So wait, there's a new drugs on the market? What is
that? So the exact cause is not known. However, the city health department released a report revealing that 2 new substances are now emerging. One is called medetomidine, which is not an opioid. It's actually a tranquilizer, a sedative used in veterinary medicine. It is not it's not designed for humans. So it's not an opioid, but it's potentiating or amplifying the effects, the sedating effects of fentanyl. And then there's this industrial chemical called BTMPS, which is also, we're not sure exactly how it's working, but it's been associated with a lot of overdose outbreaks from Washington State all the way to Pennsylvania. So we just need to keep an eye out for that.
How does someone keep an eye on these new drugs popping up? Because this is not the first time it's happening. I'm sure this happens every single year.
Absolutely. There's going to be this is the thing, Bianca, there's going to be new substances always that are contaminating the drug supply. What I want the viewers to know is that how to diagnose or how to recognize the symptoms of, say, an intoxication, right? So you're going to look for sedation. If people are excessively drowsy, a low heart rate, like in the 40s. Remember, normal heart rate should be 60 to 100, and low blood pressure. If you notice these things, make sure people are using naloxone or Narcan. Get them help. Harm reduction. Test the supply. Make sure people get the help that they need.
Well, Dr. Lipi Roy from Greenwich House, thank you for coming and shedding some light on these new and just worrisome things that's happening in the city. You have to come back and let us know what the update is on that.
Anytime.
All right, we still got a lot more of the news straight ahead. Stay with us.